All right, good morning, everyone. It's so nice to meet you guys. I'm so privileged to be here with you today, sharing a little bit of what I have to share, whatever meager offering it is. I'm Ellie Garrison. I'm an associate level therapist, recently transplanted to Kansas from Hawaii. So I'm kind of in the process of getting my licensure secured here, but in the meantime, just kind of hanging out with you guys and doing some of these trainings. Not currently working with clients. My last um, private practice that I was working for was Akua Family Therapy, run by Erin Collins and a colleague of Chris's. So that's kind of how I got linked up with you folks in Colorado. Today, I want to go over a co-parenting therapy framework. I'm going to give you guys a little bit of background on what that is and who we can serve, what client populations we can serve with this framework. But before we dive into that, if you could get these handouts, this is going to be important for our discussion today. Pull it up on your phone. Let myself or Tommy know if you have any issues getting that. Okay. Okay, I'm going to give you a little background myself. I'm Ellie. Like I said, I worked primarily with couples in Hawaii, and then one of the client populations that was underserved there was the co-parenting dynamic. So the owner of the practice asked me, "Hey, I want you to start working with these folks." I identified, like you guys, some of the common barriers to making progress with this system, right? These systems where parents were raising children between two homes. And what I found was there's a lot of really great psychoeducation out there on how do we do this right. There's many books written. I was finding a dissonance between the psychoeducation and then seeing effective co-parenting implemented. So I thought, all right, we're missing something here. We need to figure out a way to therapeutically work with these folks to address some common barriers to effective co-parenting. So I took much of what is written in this model that you guys have on your phones from a book called Between Two Homes by Bradley Craig. I worked with him a little bit. I showed him this model. This was developed by me, but really want to give him a lot of credit for the research and information that comes from these modules. So this framework should be applied within your current scope. So if you're an MFT, you're an MFT. If you're a social worker, you're a social worker, right? So your scope is therapy, unless you are specifically and specially trained for forensic psychology, okay? We are not making, within this model, we are not making judgments or assessments to pass on to a judge. That's an entirely different scope. And so just be mindful of that, that the work that we are doing with this model is therapy, okay, not forensic psychology, which we'll get into a little bit more of that as we move along. So due diligence here, there is some training that is very helpful on helping clinicians understand what specifically is our scope in working with co-parents. There is a training called Intervention Between Two Homes, written by Bradley Craig, that covers the more legal side of our scope in depth. It's, I think, $80, 5-hour CE, and we put the link to that at the very end of this. And it's also in the handouts. Also, my contact information is listed. So if you have any questions about how to access that training, please just reach out. I'm happy to help with that. Co-parenting therapy, this framework that we're going to go over today, it is going to be quite the overview. This really could be a full day conversation. So we're just going to kind of scratch the surface. What we're going to look at today is a framework that I implemented as I was realizing there's a dissonance between the psychoeducation and these folks really picking up on some of the helpful things that we can see through psychoeducation and implementing them in their own co-parenting. So what I created was a therapy framework that's a succinct, therapy-centric model that addresses emotional, psychological, and cognitive challenges of co-parenting with a focus on the child's well-being and personal growth of co-parents. I think it was Haley and then maybe Chris that had mentioned a lot of what they hear in these cases with co-parents is a lot of focus on like respect me, my feelings, my rights. And they forget that their priority should be the children here, right? Co-parenting effectively for the children's sake. So we look at addressing the emotional, psychological, and cognitive challenges of co-parenting, like we do as therapists, right? We look at those domains. So when I say this program is succinct, I have divided up into really 6 modules with 1 assessment session. So we look at why therapy for co-parenting issues. Like we kind of talked about, psychoeducation alone oftentimes may not be and oftentimes isn't sufficient to fostering co-parent alliance due to that emotional, psychological, and relational barriers that folks oftentimes feel. So this approach not only provides psychoeducation, but also helps clients identify, address, and potentially heal those barriers through therapy. We've covered what is co-parenting therapy. What we want to look at now is this document that you guys have. I have a printed out version because I'm old school. And kind of delving into what are these 6 modules and how do we move through this framework in a way that's succinct and helpful. Before we get into the modules, the 6 modules for co-parenting therapy, we always want to make sure that we're doing assessment, right? We never want to form a treatment plan or dive in with folks before we have an idea about what their life is, right? What's going on for them. So if you guys want to open up your document, I think it'll be the 2nd page that you get here to the individual assessment session. With a co-parenting therapy assessment, we're going to cover the basic biopsychosocial. Okay, we want to make sure that, like we would in any type of therapy, that we have a good understanding of who these clients are. What we're really trying to look at is what are the primary challenges to the co-parenting situation for this specific couple? What is the frequency, duration, and intensity of these challenges? That's one of the main things we want to look at. And it's going to be different for each of the co-parents. So the way that I'm just going to tell you guys how I kind of structure these sessions, but then you do you. You guys are a therapist. You know how you work best. So please feel free to take liberty with this, right? I'm just going to show you how I've done it. What I do when I have co-parents contact me and say, hey, we want to move forward with this co-parenting therapy, what I try to do is get an idea of who's really actually invested here. Typically, in my experience, it's one of the co-parents who's really wanting some help because they're the ones primarily in distress. And then the other person, if they agree to come, is kind of coming along for the ride, right? Making sure we check a box. And oftentimes these folks will be either in the process of pursuing litigation or they will be trying to avoid litigation. My goal is to help them find some peace within the system without heavily relying on the system of the courts. What happens when they go into the court situation is then they lose a sense of empowerment because there is a lot of, oftentimes it's contentious, and oftentimes the judge will make the decision about their family rather than empowering the co-parents themselves to make decisions about their family. So in this individual assessment, we're really gonna get an idea as the clinician of who's invested here and to what degree, right? That will be helpful for us in motivating them to stick with the pursuit of health. So we really want to ask good questions to generate understanding of the client's willingness to participate in therapy versus looking to build a case against their co-parent. We do not want to get in situations for the child's sake and for all involved where people are looking to build a case against their co-parent. If you get a whiff of that, you need to call it out early in therapy, okay? This is not what that's for. And in fact, in the practice that I worked for, we had a contract that they signed at the beginning of co-parenting therapy that said, we're really here to seek wellness and health of the system, not to use this information in litigation. So keep an eye out for that as clinicians. What is the motivation here? Well, what I would tell my clients too, if they're saying, and some of them are very transparent, I'm just doing this so that I can check a box, or I'm doing this so I can get a note to send to the judge. You really want to have good conversations around that because that could be a therapy specific barrier to health. Okay. So really getting understanding there. Then we ask them questions specific to their co-parenting situation. How long have they been separated? Who initiated the separation? How long has it been? Those are really important questions because what we're assessing here is they may have varying degrees of grief over the ending of a romantic relationship, if that's how their co-parenting journey started. If they were romantically involved and now they're separated, oftentimes what you'll see is that one of the co-parents was thinking about this a lot longer than the other one. Okay, so one of them may have cycled through some of the grief already, where the other is still trying to catch up and maybe a little caught off guard. So we want to get an idea of who's going through what, right? These individual sessions obviously are done separately. We want to look for more biopsychosocial factors like substance use. And you ask about both people, right? So you or your co-parent, what are you aware of? And then also get an understanding of their social connections. What is their support system? We look at other elements like legal history, education, and a big one here is cultural factors. Where I worked in Hawaii is going to be very different than where I'm working in Kansas, right? There's going to be different ideas about family. There's going to be different ideas about parenting. So we really want to make sure we are doing our due diligence to understand what are these folks' cultural factors that are playing into both their success and their barriers to co-parenting. And then, like we do as therapists, kind of getting understanding of their strengths and weaknesses as individuals, right? Who are they? What's going to help them through this process? A big one here is, this is straight out of Gottman, right? Has there ever been unwanted physical contact between you and your co-parent? We want to understand if there's abuse elements here, because if this is a physically dangerous situation for one or both of them, this may be a contraindicated approach. That will be up to you to assess whether or not to move forward with therapy if there's abuse, physical abuse going on. And then getting an idea of what are some of the particular griefs, emotions, regrets that need to experience healing in the process. Okay. And then it's really important at the end of the session or at the beginning of the session to kind of go over the contract about we're here for healing, not to build a case against your co-parent. And then explain the difference between couples therapy, individual therapy, and co-parenting therapy. In couples therapy, we're working on healing a relationship, right? We're working on healing dynamics between two folks. In co-parenting therapy, that's no longer the objective of that romantic relationship. It's about building a new kind of alliance. So really making sure that we're kind of going through that with the client. We kind of have a pinpoint, right? You take really careful notes or however you do it for the assessment session, and then use that as a metric, right? Of how are things getting better or worse as we're moving forward. Let's move forward to the first 3 sessions. I felt so untethered when I got into this work before I had established this framework. I didn't know, what are we doing with these folks, right? Like we have all this psychoeducation. I'm noticing these barriers. What am I doing with them? When I decided I'm going to organize this, because that's what I do when I feel out of control, which might be my own unhealthy coping. I don't know. Maybe it's healthy. I just went crazy organized. So I'm going to show you how I did it. This may not be your jam. So feel free if you're more flexible and you like to just follow a flow. That's awesome. That's a beautiful way to do therapy. If you're more structured like me, this approach really lends itself to that as well. So take whatever this is and make it your own, okay? Take whatever I've made and make it your own. The way I structured this was I divided the modules into 6 modules. So we have one assessment session, and then I tell the co-parents we have 6 modules to work through. The first 3 are going to be with each individual co-parent if they both agree to attend. And the reason that we do this is this is when we are really looking at some of those individual barriers, right? The grief elements, the cognitive distortions. What does that look like for the individual? And then we do conjoint sessions 4 through 6. If it becomes apparent that they're not going to work well together in the same room, or it's not safe to bring them in the same room, then we pivot, right? We might go a different direction with sessions 4 through 6, but you'll have 3 kind of individual sessions to assess whether that's the direction that you want to go, is by bringing them together. Module 1, actually, if you guys could go back to, we kind of skipped over this part, but the co-parenting therapy modules, it's the second page that you have on your handout. You can get an overview of what they are. And I've titled them all with C's because why not? Make it simple. So module 1, we have child-centered. This is where we're really working to reorient, like Chris said at the beginning, reorient that perspective from a me-centered or a romantic relationship focus to child-centered. Everything that we're doing from this point forward is looking at the well-being of the child. We're going to effectively co-parent for the sake of the child. We're going to heal and process our own individual stuff for the sake of the child, right? We're really trying to ingrain that early in the process. This is for child-centered forward focus. We're not looking back, child-centered forward focus. So module 1 is child-centered. And this is where we kind of introduce some of the elements of what it means to co-parent between 2 homes. And this is where we also dive into the benefits and challenges. This is where we're talking about really reorienting. So co-parenting work starts by switching to and maintaining child-centered focus rather than parent relationship focus. Whatever's done is done for the children, child focus, forward focus. Okay, that's what the mantra that we kind of have, child focus, forward focus. This is where we are really going to start getting into some of the individual barriers, like I said, with the co-parents. And what I've done with each module, as you can see, if you guys will, you will have 2 pages that both say module 1 at the top. One of them is the psychoeducation that you'll use as a clinician to kind of start introducing some of these concepts. And then the second page is ideas for therapy discussion questions. And this is where you will get into the nitty-gritty with your client in session. What I've done in the past is I have, and I can send this out to you guys too, is I'll have a document that I just send the co-parents in the email, and it's the psychoeducation part. And I give them homework, which I don't typically do in therapy, but this really lends itself well to some preparation and homework for the client, is I'll say, read this before session, and then we're going to unpack some of it during session. What typically happens almost always is that the parent will read through the psychoeducation portion that I've given them, and then we'll spend the entire session on 1 or 2 questions. Because what happens is that we'll break something open for them And we go with that, right? That's what we do as therapists. We say that's the thing for them that stood out for this. And so we spend the whole session unpacking that. I've seen tremendous growth by allowing that process to unfold kind of organically for the clients. So, but if you do have one of those clients, which I've had too, that say, they answer the question number one on the discussion questions in a sentence and then they go next. And you go, okay, we're going to go through all of this, right? Then you kind of have something to really get to the bottom of what might be going on for them. Module 2, this is where we start to look at the element of connection. So we're still looking at individual therapy, individual co-parent focus here. We're looking at what is the connection between them and their child, and how do we foster that connection for the children's sake with each individual parent. This is also where we promote the connection between the child and the other co-parent. That oftentimes becomes a barrier in these co-parenting relationships, is that there's an implicit, sometimes, discouragement from one co-parent about connecting with the other one. And so we really want to understand if that is an element here, okay, to really encouraging connection all the way around. The next module, which is module 3, this module is care. We are looking at what are maybe some of the elements of self-care that we want to promote with the individual. We're also looking here at the skill of setting boundaries and practicing mindfulness, meditation, engaging in hobbies, those stabilizing factors for each individual co-parent. This becomes much more critical if the co-parent is in a state of grief, in distress, if the separation is new and traumatizing to them. We really want to look at how do we promote and flourishing at this point, okay? Looking at that self-care so that they can care well for their children as well. Okay, we look at some of the social connections in this module. What's your support system? How do we fortify that with healthy promoters of good co-parenting and not detractors of good co-parenting? We want to look at the social system. If they have friends that, like to speak disparagingly about the co-parent, let's look at those relationships. Maybe what are some boundaries that we need to put up here in order to foster for you a healthy regard towards your co-parent. Session 4. This is the point where we bring the co-parents in together if it's appropriate. There may be cases where they're not ready to be in the same room together, or there may be cases where you as the clinician think maybe we need a little bit more time before we do that. Or one of them says, I don't feel comfortable, right? If we can get them together, this is where we start to work on cooperation. This can be done on an individual basis, I'll just say as well. I've done this with co-parents where we actually work through all 6 modules, and at the very end, we bring them together and we do a lot of prep around that, and that has also worked okay. So use your discretion as a therapist and also get an idea of what your clients would like as well. Cooperation. This is where we start to look at what does it mean to have a cooperative alliance with the co-parents. One thing that we want to be careful about as clinicians is that we are using positive language and that we're not using the language of the courts. So we want to make sure that we don't say your ex, right? We want to say your child's co-parent. So we're starting to build early that idea of cooperation, that we're building a new alliance, right? So that language can be really powerful to clients in helping them start to think cooperatively. Building a cooperative co-parenting foundation, establishing a strong foundation for healthy co-parenting relationship requires mutual respect, some element of trust, which that's going to get sticky in this session, right? So these are questions that you may want to go over with your co-parent prior to this session of where can you lend trust to your co-parent? What might be some of the barriers there? And then making sure that the heart of all of this goes back to the well-being of the child, right? What is the heart behind all of this? With module 4, there's some really good tools for the co-parents in managing emotions before getting into that session. So I always do that kind of prior to this session. We go over, how do you expect you're going to feel? What support do you need from me? Maybe during the session, how are we going to know if we need to take a break, right? So have that conversation before this session. And then also giving them this page will give them some tips on how can we regulate in session if we need to. Resolving conflicts and reducing tension is in this session as well. Okay, let's move on to session 5. And then if we have questions, we can address them here in just a minute on that. So the next session, we're looking at creating consistency for the child. So we look at developing cooperation between the alliance, and then how do we synthesize that cooperation into consistency between the two homes? We're looking at creating consistent rules and routines across two homes. What are their parenting styles? I have quite a bit of psychoeducation in Module 5 about different parenting styles. This is usually a pretty big sticking point between the two, is that they kind of have beef with each other about how the other one parents. And so we want to make sure that we're giving good psychoeducation about what is healthy parenting, what is authoritative, not authoritarian or permissive parenting there. Then we also explore in this module different co-parenting arrangements. It's maybe not going to work that all co-parents do cooperative co-parenting. That might not be the reality. And if that's not the reality, there's other options here. We have parallel co-parenting. So getting an idea of what is their preferred arrangement here? How can we help them build health in specifically the arrangement that they would like to have? We would like to aim for collaborative or cooperative co-parenting. Just that is seen really as kind of the best approach. But if that's not possible, helping them find health in parallel co-parenting is also okay. Module 6, that's awesome. This is where they start to work to build co-parenting plans. We introduce the co-parenting plans and the importance of having a plan between the two. The key components of a comprehensive co-parenting plan. I have given you guys a link at the end of this and on your notes to some co-parenting plans put out by the AFCC, Conciliation Courts, American Family Conciliation Court System. Sorry, that's a mouthful. But they have some co-parenting templates and plans there that you can print off and show your clients, where they can kind of fill in what's important for their specific situation. So this is where we look at continuity. How do we set it up cooperatively? How do we make sure that it's consistent across two homes for the sake of the kid? And then how do we make sure that this goes on the way that we've set it up? Continuity is really benefited by having a written co-parenting plan. Now, a clinical note here, it's important that they write the plan and that it's not generated by you. This all needs to be done for them. You're just kind of fostering and facilitating the area and space for where they can do this together. And then at the end of module 6, if you guys make it through that, inviting them back to review this, right? That you are there for them to revisit if it's not working well, the co-parenting plan. So, or if it maybe needs modification as the kids grow. Okay, guys, I know that was a flyby of a lot of information. One of the things, the directions that I go with that is that we really have an empowerment focus, right? So we look at people will really get caught up in that distrust of their co-parent, and then they tend to lose a sense of empowerment. And so then it's just kind of like a, well, forget it all, right? So what we do in that situation is we really look at, okay, what is your power to make a difference for healthy co-parenting? You can't control what your co-parent does. That's the reality, and it kind of sucks. It does. But you do have a tremendous amount of impact over your child when your child is with you. And so really looking on refocusing, right? We're not thinking about the co-parent. We're not thinking about their flaws. We're thinking about what can I do to foster healthy co-parenting. And so really replacing that angst with a lot of empowerment. And realistically, they do. They have a lot of power over the health of their situation with the child. I've had, I mean, honestly, tremendous success. I've actually never had a co-parenting client that didn't make it all the way to module 6. However, I've had co-parenting teams where one of them drops out and then the other one follows it all the way through. So that's typically more what I would see is someone sticks it out because they really are wanting help. They're coming to you because they want help. But if you make it through with both of them, I do consider that like awesome work, really huge dedication on both of their parts to want to see that the health come to fruition. I frame it this way because oftentimes these folks are cash pay. I don't know what insurance is like where y'all work, but if really, and this is maybe more of the feminist side of me, I saw that for a lot of women, this became a financial burden, but they were often the ones who wanted to go through the process. And so I really tried to respect their financial situation by making this as succinct as possible. However, if they have insurance or whatever and they want to spend more time, absolutely. You could stretch this over 6 months. Easy. Thank you so much for coming. My contact information is here. You guys have access to this. Use it. Thank you guys so much for just joining me today and connecting with me. And I hope that you all have a wonderful day. I'm going to